Hi, and welcome to this week's mini mental health training. We'll be talking about mood disorders. The two mood disorders that I'll be focusing on are major depression and bipolar. This training will focus on recognizing the symptoms of mood disorders, describing effective communication strategies, and I'll also talk about how mood disorders may be affected by COVID-19. The definition of a mood is a pervasive and sustained emotion that colors the perception of the world. Everyone has moods like happy, sad, angry. A mood disorder is a disruption of normal moods that interferes with someone's life. First one is major depressive disorder. It affects almost 7% of the adult population and is the leading cause of disability. Everyone gets sad and has bad days, but major depression is beyond sadness or passing sad moods. It is persistent and significantly interferes with life. Symptoms include depressed mood most of the day, every day, diminished interest or pleasure, changes in sleep like sleeping too much or too little, weight change, loss of energy, feeling of worthlessness, diminished concentration, and thoughts of death or suicide. Not everyone has all of these symptoms, and depression looks different to each individual, and it could be severe or minor. However, this list of symptoms is something to keep in mind when talking to someone diagnosed with depression, especially that they may be having thoughts of suicide. Again, not everyone who has depression will think of completing suicide, but it is a good question to ask. When you come in contact with an individual with depression, it is important to use active listening. Observe what is going on and think what is contributing to the situation. Did something just happen to this person? Could this be substance induced? Were they drinking? Remember, you cannot fix the situation. It's natural for us to want to fix things. However, in this situation, it's best to just use empathetic statements and do not minimize what the individual is saying to you. Also, be patient and allow the person time to respond, especially if they're in a crisis at the time. Along with giving them some time, short statements are helpful because the individual may have a hard time concentrating. As I said, be aware of suicide risks and ask the question, are you thinking of killing yourself? Follow up on any hints that the person's giving you, like they don't have anything left to live, they're feeling worthless. Especially if you feel like someone is at risk, make sure you ask, are you thinking of killing yourself? Once you establish rapport, some good questions to ask are things like, what are you looking forward to? Helps the person to start thinking of positive things going on, things that they're going to look forward to in life that they can get to. Another question to ask is, when have you felt this bad before and what helped you last time? This can start a conversation about coping skills and things that can help and things that they usually do to get out of what is going on. The second mood disorder that I'll talk about is bipolar disorder. Bipolar disorder is characterized by episodes of depression and mania that can last from days to months. It affects 2.6% of the adult population. Symptoms of mania include either an elated, happy mood or an irritable, angry, unpleasant mood, an increase in activity or energy, more thoughts and faster thinking, increased talking and more rapid speech, which is referred to as pressured speech. Individuals are ambitious and often make grandiose plans and ideas. They have increased sexual interest and activity. They also experience a decreased sleep and a decreased need for sleep. Same with depression. If you come across someone who has bipolar disorder, take a step back and observe what is going on. Is this mental health? Could it be substance abuse? Is something happening that they're trying to explain to you? Try not to interrupt the rapid speech because it could make the individual angry and escalate the situation, making it worse. Don't argue with unrealistic plans. Use empathetic comments such as, sounds like you're really excited about your ideas. It helps build rapport if you seem interested in what they're saying. Slow and lower your speech so that they, in turn, will slow and lower theirs. If safety allows, let the individual pace and talk. Also, be aware of sudden mood changes and irritability. With everything going on, people with mood disorders may be struggling. People are isolated and cut off from supports. There could be an increase in substance use because everyone is stuck at home. In people's normal routines, there's also disruption in people's normal routines, and their access to their mental health services looks a little different because everything is virtual. So they may not be as active with their mental health stuff because their counselor is no longer at their clinic. They are now at home and everything is virtual. Um, Also, there might be an increase in stressors like job loss and financial problems, which could make depression worse and is something to keep in mind when talking to people. So, if someone does have depression and you know they've been diagnosed with it, explore what's been going on in their life lately, see if there's anything that they can do to help. Reach out to family and friends and their counselor, things like that. This is a hard time for everyone. I want to thank you guys for everything that you do. Here's my contact information if you need anything. Thank you very much and stay safe.